Thank you for joining today. This is the provider CRISP training, specifically on how to send an MPRA form for the IMHS project through the CRISP system. So first I'm going to show you how to access CRISP. The majority of you will be accessing CRISP through In Context. However, there are a few of you that will be accessing through the CRISP portal. In order to access the CRISP portal, you're going to go to crisphealth.org and it will come to this main login page here. Once you're into crisphealth.org, there's login and you will choose the CRISP portal. Once you hit CRISP portal, that'll automatically prompt you to put in your password. And I also encourage you to add that page as a favorite by starring it up at the top so that it's easily accessible for you to use in the future. So that's how you would access the CRISP portal. Once you click that and logged in, you would then be here on the main portal page. If you are using In Context, you would be within a provider's or within an individual client's In Context. So we'll pull into In Context here, and I'll show you where you would click. So as you can see, you have all of these little icons here on the side. If you ever want to open and see what they all say, you just click this button down at the bottom to collapse or expand the menu. And what you're going to do is you're going to hit the apps button. And when you hit apps, additional apps will come up here on the side, one of which is not listed here on my screen, is it will say create referral. It'll be a little pencil and it will say create referral. That is what you are going to click on to be able to go to the referral portal page. So again, you'll be here on that main menu and you'll have your normal apps here. You're going to come and hit the apps button. It'll change out the additional apps here. One will say create referral with a little pencil, and that is what you're going to click on. If you're logging in through the portal, you would put the patient's first and last name and date of birth, and then select that person's name. Once you do that, you will have a list of different options. The main and what the one you're going to choose is create referral. Many of you will not have the volume of options here, but this is, so it should come up a little sooner, but here is create referral, which is what we're going to click on. So either through In Context or through the portal, it will all, when you hit create referral, it will come back to this main page here to be able, or this main search button to create the actual referral. So in sending the referral, you're only going to work here in the search for organization name. And what you're going to do is you're going to search for the county that the patient resides. Not necessarily where you're located, but where the patient resides. So example, if you're in Somerset, you can just type in Somerset. And as you can see, there's a variety of different options that come up here. For Somerset County, you're going to be filling out the MPRA. So you're always going to look, everyone will have the name of the county, and then it will say MPRA, Maryland Prenatal Risk Assessment, and that is the one that you are going to be selecting to send the referral to. So if you put in PG County, as you can see, Prince George's County is here. And so you would have the MPRA available here to be able to also send that referral. In order to send a referral, you're going to check the box right next to the form that's being filled out. And then this will light up the create referral for program. And you will then hit that button and choose create referral for program. That'll automatically bring up pull in the patient index information here. This will, we always ask you to update the telephone number if needed. You can add an alternate telephone number and the type if necessary. Otherwise, this pulls from our master patient index. And again, just making sure the telephone number is correct. You are then going to be asked about the patient insurance. The only required one is anything with an asterisk here. These are your options. You will be answering additional questions about insurance further down, so you only have to choose the main category here. It will then show where you're sending the organization name of where you're sending the referral to. You can do, and it will have the name of the program. So this is a kind of a confirmation. You make sure you're sending it to the right place. And then there is this ask from MDH that you do tell the patient this statement here, that information from this assessment may be shared with your local health department to help connect you to services. This could include WIC, SNAP, and home visiting services, as well as other programs. So please make sure you share that with the patient prior to completing the form. Then we go into additional basic demographic. This is really information that's important on knowing what specifics about the patient. One required field here is the county of residence. So making sure you fill that out. So again, we make sure that's correct. And any changes that are from above, such as if the address is wrong, you can put in the correct address. Anytime you're going to see these check boxes here, you're going to choose whatever's the best option. So if the person has a communication barrier, you would then check that box, or if they require an interpreter. You also have a drop down for what their primary language is. And then you have these radio buttons for biological sex and gender identity. Same for race, you will have a drop down, and ethnicity, and then education, as you can see. Marital status. And then we have here more about insurance information. So what are they currently doing? Are they currently enrolled in Maryland Medicaid? If so, what's the name of their MCO? Here's their OB history. As you can see, there are required fields here. When you have the OB date of initial visit, there is a calendar here for you to easily select a date. And then we have risk factor assessment here, where you would choose any boxes that apply to the patient. So if they have stress or anxiety, you would click that button. If they're having any issues with substance use, you would click the button. Or any additional support that they need. That also includes for medical risk factors or STI history or any chronic diseases. As you can see, once you check certain boxes, additional questions will come up. And then additional pregnancy risk factors. And then there is a free text box here where you can enter any specific information about the patient that you think is important. So patient needs services for food. And then the bottom part here is that referring provider. So are you the one completing this, or are you doing it on behalf of a provider? If you do it on behalf of a provider, the search, you can easily search for the provider's name through their first last name or through their MPI, or you can click you're referring on yourself and it will auto fill in. The NPI number is not required if you do not have one. So I know it's highlighted or starred there, but that is not a requirement. However, a phone number is required. And then you do have to check this box right here that you attest that the patient is aware that this form is completed. And that is really just that statement above that you stated to the patient. It's just saying that you completed that statement to the patient above. And then you would hit the submit button. Once you hit the submit button, you will get a confirmation. number at the top of the page. So a new page will come up with the entire form completed, and it will have the confirmation at the top, as well as you will receive an email of the form being completed. So here's an example of what that form looks like, or what that email looks like. It will have where you referred. So in this case, it would say Prince George's County Health Department, and you would have the MPRA form. So it would have that whole program description. Then it would have your confirmation number, and a reminder that you can update your referral status in the portal, that you would be able to see that. So you will get this email confirming the completion of that MPRA form. You will also be able to download this form once you get that confirmation page. I'm in the live environment here, so I'm not going to submit a referral, but this would then go to, this down at the bottom would show download, and you would be able to download that and save that for your files. Just also a reminder, if you wanted to send referrals to other organizations, you can do that in the CRIS system. You can do that by searching specifically by name, or you can do that by resources. So example, if we wanted Meals on Wheels, you would click Meals, and you would see all the different resources. If you weren't quite sure, but you need food assistance, you could put in food. You can also search by radius if needed, and you can see whenever it says HIE directory, and you have that checkbox there, you can submit a referral to any of those programs. We also are connected to Maryland 211, which has over 7,000 resources available, and provides the additional contact information to give a patient on those resources through the telephone number. But if it does say the HIE directory, you are able to check that box and submit an electronic referral. Once you submit the referral, you can see updates on your referral in the In Context app. So when you click here, you would click on In Context, and you would be able to see the referrals. This is a test patient, so this test patient will not have referrals, but just so you're aware, you would come to the Care Coordination tab, and then you would go to referral history, and all of the referrals, so the date of the referral, where that referral was received, the name of it, and the status will be available for you, and when it was last updated. You can then click on that referral, and it will give you additional information that the health department has updated on the actual referral for you to be able to see the status and updates of contact with the patient. So again, in order to access that, you would come back to In Context, hit Care Coordination, and then go to the referral history page. More additional screenshots of this are available in the user guide. So again, that was an overview of how to submit the MPRA to the health departments. Thank you so much.